And we can get started with the presentation then. Okay,
Yeah,
perfect.
you guys are good to go.
Can I get sharing access?
Yes. Sorry. One sec.
All good.
If I can figure it out, it's the most important part.
All good.
Uh, okay, are you able to share now?
Let's see. Yes.
Okay, cool.
All right, perfect. Can you guys see that?
Yep.
All right, so yeah, let's go ahead and get started. Hello everyone again. My name is Samir, and we're gonna go and get started with the presentation. Usually this presentation it can take a little bit longer, like 30 to 40 minutes, but we're gonna try to go like quickly through this presentation. With that being said, if you guys have any questions, please put it in the chat. Let us know immediately so we can like stop and address the questions as we go. But yeah, let's get started. So a little bit about us.
All right. So, hi everyone. Again, my name is Abby, and I'm a current student at Kansas City University. There's a little bit about my education on there. During my gap year, I did a master's in medical sciences, and I applied through all three application services. So AMCAS, ACOMAS, and the TMD SAS, which is the Texas application system. And I had experiences with six DO interviews and two MD interviews. And then some of my hobbies include tennis, pickleball, and cooking. So I'm happy to answer any questions about like the application services or maybe like gap year ideas or things like that. So that's a little bit about my background.
Right. So a little bit about me again. My name is Samir. I went to the University of Iowa. I currently go to Rush Medical College in Chicago. It's near downtown. I applied in the 2022 cycle. I had three MD interviews, four DO interviews, and I was able to get accepted into, I want to say, six or seven of those total interviews, including University of Iowa, Carver College of Medicine. So if you guys have any specific questions about Iowa, please let me know. Here's a little bit about my clinical experience, volunteering research, and in terms of hobbies. Love watching NBA, big table tennis guy, anything with love all racket sports, and then big on eating and finding new restaurants in Chicago. So, some just general information about how to make yourself a competitive candidate when it comes to applying to medical school. We kind of divided this up into four different things: research, shadowing, volunteering, and clinical experience. So, just to start off, talking a little bit about research, I know a lot, like when I was in undergrad, and I know one big thing that people think is that you have to have all of this research in order to get into medical school. You need multiple publications and all this and that. The truth is, you do not. You do not need like a plethora of research publications or anything like that. What's more important is that you have a project that you know very well, and that you saw it to completion. So even if you have maybe a project that you presented at a conference or two, that you spent a lot of time on and you can articulate and talk about very well, schools love that, right? So you don't need to worry too much if you're not getting publications. It's not something that's very common in undergrad. Even in medical school, a lot of my classmates first year, a lot of them hadn't even touched research. So it's not something that it's something that it's nice to have a little bit on your application to say you did it, but not something super crazy that you have to get very involved in. Next, I want to talk a little bit about volunteering. Similar boat. Volunteering is great. It's great to have on your application. Um, and it's good to find something that you actually enjoy. I used to volunteer at the University of Iowa Hospital and clinics, and a lot of what I would do would be like stalking, for example. And it just wasn't the most enjoyable experience. But then I spoke with many people that, helped out with like, I think MAPS, if you guys still have like mobile clinic, for example, that they were able to really get more out of that experience. So really finding something that you really enjoy Certain schools like volunteering more than others. Rush, for example, is big into community service. So even non-hospital volunteering is great to have, just again to show that you have something in some type of agenda that you enjoy and want to like push forward that's like not medicine. So volunteering is definitely important, but it's not like you have to get 1,000, 2,000 hours, for example, to be a competitive candidate.
So, adding on to that, I'll touch on some tips for shadowing. Again, I would really emphasize having quality of your shadowing experiences over quantity. And a big thing is you want to try to have a long-term experience. So, one, that'll help you form a relationship with the physician you're working with, and also it gives you a better picture of their day-to-day life, and you learn a lot more about the specialty that you're in. And so if you do have a long-term shadowing experience, that could help you a lot. Maybe that physician could even be a letter of rec writer for you. Another tip I have about shadowing is just keeping like a journal or like some type of record about cases you see or experiences you've had while you're shadowing. This really is helpful when it comes to interviews or essays because sometimes after you have a lot of shadowing experiences, it can kind of blur together if you don't really, make an effort to write down what you saw that you thought was interesting or things like that. So definitely have some sort of record, not only about the hours, but also what you're seeing, what you like, what you maybe don't like, in certain specialties. And then finally, a tip for shadowing, when I was applying. I split it into like three different activities on my application. So I had two like listings for two specialties that I shadowed, and those were both long-term experiences. And then I had another entry for just like an assorted list of specialties that I shadowed and just exposures that I had. But I made sure to go really in depth about what I saw and what I learned from my experiences. And then lastly, we have clinical experience. And this is really a way for you to stand out from other applicants. For example, I was a scribe in undergrad. And so I worked in outpatient and I also did virtual scribing during COVID. And I think it really helped me familiarize myself with the clinic, just the flow of seeing patients and just all the different moving parts of the healthcare team. And that really helped me talk about why I want to go into this profession when it came to interviews. And again, it's just more exposure for you. So you can learn about the EMR, you can learn more like terminology that will be useful for you in the future. So that's just one example of something you can do to get that practical experience prior to applying.
And I just want to reiterate what Abby said. Clinical experience, super, super, super more important. Out of this slide, honestly, personally, I would say it's the most important part of your application. A lot of people focus on research, a lot of people focus on volunteering, but clinical experience is really where you stand out. So going into the primary application, so you're done with your MCAT, you're, about ready to apply to medical school. So there's two portions of the application. There's a primary application and the secondary application. Primary application, you can start opening it up and looking at it, I want to say in May. And that contains things like your personal statement, so why you want to do medicine. It contains letters of recommendations that you can upload from different doctors or different professors that you work with. You can list activities and experiences that you did over the course of your 4 years. Um, Depending on if you do the MD application versus the DO application, the amount of activities you can put on is different. And I think it's important to note that you can't always write too much. But that's another part of the application. You put in your MCAT, your GPA, and there's some random exams that Abhi will hit on in the next slide. After you send out your primary application to, however many schools, usually, almost every single school you apply to will send out secondary applications. That is basically what they'll do is they'll send out the secondary application and they'll want you to send in like an essay or two, um, basically saying why you want to go there. They might ask a question about just additional questions that you have to answer. Once you send that in, then you can start getting interviews. So it's the primary application, secondary application, then interviews.
So I just want to jump in super quick. We had a question from one of the students about how I went about finding my job as a scribe. And me personally, I worked for Scribe America. So there's multiple companies like that where you can get trained through them before you get matched at a hospital site. So there's Scribe America. There's a company called ProScribe, I think, ScribeX. There's a bunch of different ones that you can look up and just apply online. Another way to do it is if you have a connection with a doctor directly, you can ask them, maybe if their hospital is hiring or if like their practice or their team is looking for a scribe. So there's different ways that you can go about it.
And to go off of that, another great, relatively easy clinical experience to get into is being a nursing assistant. A lot of places like nursing homes, they require a CNA certification, so like classes that you take. Last I checked, University of Iowa hospitals, you actually don't need that certification. They'll train you there. So that's a great, easy way to get some clinical experience. So another great thing to look into. Let me go back. Okay. So in terms of the primary application, so personal statement, very important. Start writing that as early as you can. Don't wait until a month or 2 months before your application is due. Um, so I took a human physiology class. I already forgot what it was called. But basically they used to offer it at least at Iowa, where they basically help you write a personal statement. And our teacher or professor always stated that the best personal statements were essays that talked about a story of overcoming some very significant challenge that occurred in your life. Um, so that's what I talked about, and I really like my personal statement. Try to be different. Again, personal statement is important, but these admission committees are reading like a lot, hundreds, right? If you can try to sound a little bit different than what a normal, like a typical person would write about, that might help you stand out. So really like take some time to brainstorm something that's unique. And let's see. In terms of activities and experiences, I hit on this a little bit. AMCAS takes about 15 activities that you can write. So of these 15, I can't remember the exact amount, but it's like one small paragraph that you write for each experience. It's not much. So that's important to note. But there are three activities that you can write an additional 2 or 3 paragraphs. So those are called the most meaningful experiences. So for example, if you were a part of MAPS, right? If you're on an executive board of MAPS, you can talk more in depth about maps, how that, changed your perspective on medicine, wanted made that you want to go into medicine. So you get three experiences where you can talk about more, and then you have 15 total that you get like a paragraph for. Important to note that whenever you apply, if you're continuing to work in some type of job after your application, you can put on hours that you are going to work, even if you haven't worked them yet. Um, and yeah, that's it.
Okay, so we have letters of rec. So one software that a lot of students use to like gather their letters of recommendation and keep them organized is called Interfolio. Basically, you can save all your letters there. You can put a due date on there. You can have them send reminders to who your letter writers are. It also is confidential. And then they also do, I think, like quality checks where they can make sure it has the letterhead on there and it has the signature of your writer. So just logistically, that software takes care of a lot of the things that you need to look out for when you're submitting letters of rec. When it comes to getting them, I would do it as soon as you can. For example, if you have a professor that you think you would want to get a letter of rec from, right after the course ends that you took with them, just have them write it, even if you're like months away from applying, just because it'll be fresh in their head if you just had a class with them. So try to get those letters early, and you can always decide later if you want to use it or not, but it's better to have more than you really need. And when you're also asking someone to write a letter of rec, make sure that you ask if they would write you a strong letter because it really does make a difference. when they read the letter, when the admissions committee reads it, they need to be able to tell that you formed a good relationship with this person and that they're able to talk about your strengths. And yeah, I think I have on there two science, one research, one physician letters is what I did. So that's pretty much what I have for letters of rec. And then when it comes to random exams, it really just depends on the school. There's a couple ones, like one is called SJT and one is called Casper. So these are more emotional intelligence exams, and most schools don't require it. There's just a small list of them that do, and they'll have different video or word-based scenarios, and you can also type free responses for some of these. So, yeah, that's just something you might encounter while you're applying to certain schools.
All right. So for secondary application, now you've submitted all your most meaningful experiences, your MCAT, your GPA, your personal statement, all that stuff. You've done that. Now schools are starting to send you more essays to write. So, one important thing that you can do if you want to get ahead of the game is that typically you can look up the school you apply to, and the essays that they ask for are usually the same every year. So you can start pre-writing these secondary essays. That's really crucial because the moment that a medical school sends you a secondary application, they want to typically have you submit those essays within 2 weeks. So the earlier you can start writing, the faster you can send it in once you get it. And that will improve and increase your chances of getting into that school. In terms of like what to write, try to look into the school a little bit, see if there's certain missions and values that you can talk about. For example, Rush Medical College in Chicago, super, super, super big into community service. They love community service. So I tailored my application and my essays towards that. Other schools, maybe like I would say more like Ivy League schools or top tier schools like Harvard, Yale, Stanford, they're going to care more about research most likely. So you can tailor your application more towards that. So you really have to figure out what missions and values the school holds dear, and then talk a little bit about why you'd be a good fit. In
Before you go on to the next thing, can I interrupt you quick? There was a student question asking just about the number of hours and if there's like a cutoff or if there's a number that you should be aiming to get in terms of clinical experiences. Um, so it's not like there's a cutoff. I think, for example, I know that like for PA school, they have like, I think it's like 2,000 hours or something that you need to get. So to apply to med school, there's not specifically a cutoff. I think it is more important just to be able to talk about what you got from it. But it's also good to have the bulk of your hours or like all your hours in one place or with one experience rather than a bunch of different little things because it doesn't show as much longevity or you might not be able to talk about the experience as much. But yeah, Samir, feel free to add anything to that if you want.
I would say this is kind of an arbitrary number, but I don't know, try to get like 500 to 1,000. Like I know it sounds like a lot, and you can probably get into medical school without that, but that will make you very competitive. Nowadays, the average age that people are matriculating into medical school is much older. I think it used to be like 22. It's probably like 24 now, right? So people have extra years. What are they doing in those extra years? A lot of them are working, right? So when they see applicants that have 500, 1,000, 2,000 hours, they're very impressed by that. And someone who works that much in a clinical setting, when a medical school sees that, they're like, wow, this kid has been in a healthcare setting. He wants to be in medicine, right? Versus someone that's never worked in that has no clinical experience. I would say you're definitely at a little bit of a disadvantage. Even if you volunteered, even if you have research, personally, I think clinical experience is what really puts you above and beyond. So arbitrarily, I'll say like try to get 500 or 1,000 hours. I think I had between that number. I worked as a nursing assistant and a phlebotomist. That's how much I had. Um, I think we're gonna have a little presentation about MCAT and stuff later as well. I think Gavin, you're giving that presentation at the end. So I don't want to hit on, just want to confirm, right?
Oh no, I'm just anecdotally talking about my prep and some things like to the side. I wasn't planning on presenting.
Okay, I don't want to hit this too much then, but
Okay.
basically, very simply, in terms of studying for MCAT, try to take 3 months if you can. Do 1 month of content review using Kaplan or whatever books you want. For the second month, you can do as many practice questions as you can using things like UWorld or I use something called Blueprint. And that third month, that's when you should do AAMC resources. So AAMC resources are going to be the most reflective of how the actual MCAT will be. That's when you should take all the AAMC like practice exams and do all the questions. So very simply, that is what I would do to prep for the MCAT. You can take a look at some of the resources we put down, including some of the paid resources. I did like a blueprint course and a Jack Weston course. Ubby did a course with BMO. Um, I don't want to spend too much time on this, but if you see anything that you want us to talk about more specifically, please ask. I'll give you guys like 10, 15 seconds just to like take a look real quick. Okay.
All right, so now we're going to talk about school selection. So here we have our three different categories. We have safety schools, target schools, and READ schools. So that's kind of how you can think about it when you're making your list of what schools to apply to. Your safety schools are going to be those where your MCAT is probably 3 points higher than what the median is for the school's most recent class. So that's the data you're going to look at. Target would be when your GPA and your MCAT pretty much match what their median scores are, versus Reach would be where your MCAT is about 3 points lower than what their median score is. So those are just kind of guidelines to help you categorize what schools you're applying to and just make sure you're applying to an even amount in each category. So the MSAR is a online resource. It stands for the Medical School Admissions Requirements. And this is the online database that'll show you all the stats for every medical school, all their requirements, and each like not graduating class, each entering class and what their stats were. So it'll really help you figure out your likelihood of maybe getting into that school based on your stats. So you can get a subscription through that online, and I would highly recommend using that to curate your list of schools that you want to apply to.
And I also just want to reiterate what Ubby said. I would say apply to 20 or 30 schools. It might sound like a lot, but that will optimize your chances of getting in, the first time you apply. Another big mistake that I see people make is they don't apply to DO schools and they don't quite understand the difference between MD and DO. And I think at Iowa, when I was there, even I didn't quite understand like osteopathic medicine very well. Truth is, they're very similar. If you have specific questions about that, you can let us know. I go to an MD school, Ubby goes to DO school, but I think that's a very, very big mistake people don't make and might not have a lot of knowledge on. So apply both MD and DO. All right.
All right. So lastly, we are going to touch on interviews, just some info and tips on that. So starting off, there's a bunch of different formats that your interview could be. The ones that are most common, you'll have your one-on-one with one other interviewer, or you can have a group interview. So I had a few of these while I was applying, and basically you'll have it depends on the school, but I had like a group of 10 students that were applying, and there's a faculty member also in the room, and they're just overseeing how you all work together, who's like leading the group and facilitating different people's opinions. So that's just a unique experience that you might see in one of your interviews. They also have something called MMI, which is multiple mini interviews, and essentially you'll be rotating through different stations and you will have a couple minutes at each of your stations to answer whatever their question is. The benefit of that is that you get to rotate through different interviewers. So if you feel like you didn't answer one question to the best of your ability, like you can just reset and just move on through the questions. And some schools will do a combination of these formats. When it comes to question types, again, there's these different categories. They're pretty self-explanatory. So if you guys have any questions on that, let me know. One example I'll point out is you might have some ethical questions. For example, what would you do if a patient is refusing a life-saving treatment? And kind of just talk through your thoughts on that. And as long as you can justify your thought process, I think that's all the interviewer really needs in order to continue that conversation and go into that. So you can look online for different ethical questions and just practice talking through those. General tips. So some schools will give you the information for your interviewer beforehand. If they do, I would definitely look them up and see what role they play at the medical school. For example, if it's a professor, you could ask them about their research, or they would probably be able to talk about research opportunities. If it's somebody in student success, like you can ask them, how do you support the medical students? So try to tailor your questions towards what their role at the university is, because that's probably where their expertise is. And looking up the interviewer ahead of time could also help you. So, for example, at one of my interviews, I was talking with one of the professors, and one of my interview questions was actually related to his research. It was just more of a broad question, but the conversation that we got into had to do with what he studied. So going into that, knowing that he was a researcher definitely did help me. And lastly, we have post-interview etiquette. Sometimes schools will allow you to send a thank you note. Sometimes they'll just tell you to send it to the admissions office and they'll pass it on. So it just depends. If you haven't heard from a school after 4 to 6 weeks after interviewing with them, you can send an update letter, but only send an update letter if you really have something of value or something relevant to add to your application. Talk about like why does this particular thing strengthen you as a candidate, or something that wasn't already talked about on your application so that it's worth their time to go over that update. So, yeah, those are the tips that I have when it comes to interviewing at different schools.
So that is the bulk of our interview, or not our interview, sorry, still on what Obi was talking about. Bulk of our presentation. If you guys have questions, you're more than welcome to either message us or email us. Um, yes, thanks for having us. I don't know if there's any more questions that were put into the chat.
Just one thing for everybody, make sure to fill out that attendance form so you can get those points for your graduation cords. We should just send it again.
Okay, I did get a message to explain the difference between MD and DO schools. I'll start off and then I'll let Obi take it. So very simply, MD schools, they focus on allopathic medicine, which is basically like almost like medical treatment for everything, right? And then DO schools do the exact same thing, but they get trained in osteopathic medicine. I think the each school has to do like 300 hours of osteopathic medicine. And that's where I'm just gonna let Obi take it so she can explain it. But they're very similar. They're very similar.
Yeah, that was a good intro. So essentially with the osteopathic schools, your curriculum adds on a little bit more. So they are looking at medicine as a more holistic view. So you're looking at maybe different social factors or just looking at the body as a whole when you're figuring out a treatment plan for a patient. So in addition to your curriculum, you also will have OMM, which is osteopathic manipulative medicine, and that's when you are using your hands maybe to manipulate the patient or give them more like instant relief maybe for something that they might be going through. And we have labs for that. So in addition to anatomy labs that you'll see in MD and DO schools, you'll also have OMM labs. And this is where you learn different osteopathic techniques. So because it is a more holistic view of medicine, when it comes to applying to DO schools, something that they look for is seeing that, um, you really care about the patient as a whole, or you're looking at more than just the pain that they're in or the problem that they're going through. You want to see what other things are affecting their life or affecting their health, like what access do they have to healthcare in general, or maybe like nutritious foods or ways to exercise, things like that. And all these things play into how you care for a patient and how you even prevent chronic conditions and things like that. So I would say if you're interested in applying to a DO school, um, think about community service, think about volunteering and being able to see other things that impact a patient's life and tie that into their health as a whole and how that would affect their health care that they're receiving. So that's really big for DO schools. And yeah, if you guys have any other specific questions about it, I'm happy to answer, but it is pretty much the same medical curriculum, and then you have your extra OMM aspect of it.
And I also just want to reiterate another big difference between MD and DO schools is that a lot of MD schools are attached to hospitals, right? So like University of Iowa Medical School is attached to the University of Iowa Hospital. A lot of DO schools don't necessarily have a hospital attached to them. And so sometimes I would say because of that, um, it it could be a little bit more difficult to do research or interact with people in competitive specialties at a DO school. With that being said, there are DO people with DO degrees in every single specialty. So again, it's very important to note that they are extremely similar. And you can with like a DO degree, MD degree, both doctors, and it's I would say a big mistake people make is they don't apply to both. So that is one thing I think is very important.
Yeah, and also one quick thing with that. If you know, like early on, that you're interested in primary care, for example, like family medicine, pediatrics, internal medicine, these are all really big when it comes to DO, just because it's more of a holistic view of the patient and it's not as specialized. So if that's something you're interested in, I think there's a lot of opportunities for that as a DO. So that's just something to think about.
A student had a question. The student's 3 months out from their MCAT and they're moving out of their review phase. They're wondering if they should be doing practice exams weekly along with the practice questions from UWorld and AMC. Personally, I would say yeah. I would try to do one practice exam a week. I was really anal about mine, so I would wake up at like 7 a.m. My actual test was at 8. It was on a Friday. Every Friday, I would wake up at 7, no phone, and then simulate, go to the library, no phone, just kind of simulate. Because when you actually take the test, you can't have your water bottle in there. You can't have your phone near you at all. You have 15-minute breaks to go get some water or energy drink, whatever. You have a 30-minute lunch. You want to simulate your actual test date. And I would do that once a week. I did about 8 to 10 practice exams. Probably want to do like at least 4 at the minimum. But I would try to do them every week. I wouldn't do more than one a week though. That's too exhausting. And then the day after, I'd recommend reviewing that exam, make a spreadsheet, go through every question if you got it right or wrong. And sometimes you got lucky and you didn't actually know what you were doing. So that's good to know if you didn't know that information, and then you know like what you actually need to spend time on. But yeah, and then anecdotally, just talking about kind of my MCAT prep. Um, I kind of just did the typical content review for about 2 months. And then I did practice questions and practice exams for about 3 to 4 months. I took my exam in August and I started studying in March. So my prep was about 5 months. And I am a little bit biased, but I think taking in the summer is kind of the best because then you have the space to retake it if you need to. Um, but just take it when you're ready. That's more important. But yeah, that's kind of what I did. I did Kaplan and There's a YouTube channel that actually goes over the Kaplan books as well as like secondary reinforcement. And then I did UWorld. I did like 90 questions a day with Anki, and then I would do one test a week. And then I would, the day after the test, I would review. The day before, I would take a rest day. And then I took my actual exam. For me, I don't have the bandwidth personally to do both at the same time, to be honest. So I purposely did my exam over the summer and most of my prep. So I started in March and I was only studying maybe like honestly 5 to 10 hours up until like May. And then once the summer kicked in, then I was studying probably 20 to 40 hours depending on the week. Like for 2 months, 3 months. Um, but it is, I would, if you're going to do it during school, I would try to do it during a lighter semester for sure. And kind of treat it as like a very heavy extra class that you're going to be having to spend 15, 20 hours a week on. But yeah, if you do guys have anything else to say about that, someone had a question about balancing schoolwork and MCAT prep.
I agree with you. I think it's definitely nice to be able to focus on that ideally without anything else. But if you are taking classes while you're doing it, have a light course load. I personally took the MCAT during the pandemic, so I had a lot of time and that was just all I did for a few months. But yeah, it's much easier when you can just focus all your energy onto that and stay consistent with it.
Yeah,
Um,
Gavin, I think you kind of, oh,
I'm sorry, go ahead.
no, you're good.
I would say I also pasted a link. I have a Google Drive with everything I pretty much used. So it gives over like timeline stuff of like when you are going to take your MCAT. So if you're going straight through and you're not taking a gap year, that means you have to take it ideally uh, the spring of your junior year. And there's a whole timeline thing on that. And then there's also just information for resources, like third-party resources. I recommend reading the books and then mainly focusing on videos on stuff that you're not getting right in your world or practice exams. And I highly, highly, highly stress reviewing your exams and being very anal about that because a lot of times you're just missing the same thing over and over again. And if you're just doing general review, you're not really going to improve your score. And at a certain point, like once you get at a certain point, it's exponentially harder to get 1 point than at a closer score to the median because that's just how it's. Oh, someone has a question. This one's probably better for you guys that haven't done secondaries.
Oh, sorry, I was muted. So when it comes to secondaries, every school is going to have a different prompt. So I think it really just depends on what their prompt is. For example, if their prompt is, why do you want to go here? Even if it's not your, your reach school or your top option, you can still talk about how your experiences align with their mission statement. Or you can say, hey, like they have a really, specific like maybe track or like concentration like global medicine or maybe certain research that you want to be involved in and connect that to your experiences. So it doesn't necessarily you don't really have to talk about the fact that this is like the school that you want to go to the most, but if you can find things that are specific to that school that other schools may not necessarily offer, then that can show that you took your time to do research about them and it wasn't just like a blanket application that you could submit to any school. So, yeah, I would just take the time to go on their website or like if you know someone that goes there, or you can email the admissions office and say, hey, can you connect me maybe with some students so I could talk to them about their experience? And just be able to offer something specific that you truly are interested in, and that'll help them see your interest.
I agree with Abby. And then I would say just on top of that, even if you have like you're interviewing at a safety school, you you put a smile on your face during that interview and you act like that's the only medical school that you want to go to and like that is like where you want to be. You really want to, and no one's going to ask you if there's like other medical schools that you're interested in you want to go to, right? So at every interview you're doing what you can to make them know that you want to be at that medical school. And you'd be surprised, I mean, like even Rush, I would say when I categorize it in terms of like my reach versus this and that. I think it was one of like my safety schools, for example. And that's where I ended up. So even though a school might be, you might consider it a safety school, it might, you might go to that interview and realize, wow, this is like, I really align with their mission and their values. I really like the school. I like the location. So really treat every school, whether it's reach, whether it's, safety, as if that's exactly where you want to go.
Does anybody
Also,
else have?
uh,
Sorry. Go
no,
ahead.
you're good. You're good. So we talked about like the reach and the target and the safety schools. So of course, the way we talked about it was based on your MCAT and GPA. But in reality, like just because your scores match up with a certain school, that doesn't mean that like that would be your favorite school or that would be a school that you want to go to. So also just keep in mind that there's a lot more that goes into it, such as what is their curriculum like, or how long do they do preclinical for before they start their rotation. So that was just a guideline for you to make a list of schools, but it doesn't have to be so cut and dry, and you can think more about why you really want to go to a certain school beyond the numbers.
Does anybody else have any questions? Um, no. I will say one more thing about the MCAT. In that drive, there is a 90-page document for Psych Soc. Amazing. If you memorize that, you will do really well on your Psych Soc part. It literally boosted my score like 3 points 2 weeks before my exam. I just memorized that document and it was wonderful. Um, but yeah, if no one has any other questions, I think I just want to say thank you to both of you for your time today. I think you said a lot of valuable information that um, is really good for everybody to know. Um, and if you guys have any questions, you guys can reach out. Their emails are on screen. You guys can also reach out to me without any MCAT questions or prep. I don't know, whatever. But yeah,
Awesome. Thank you so much, you guys. Just a reminder, if you guys are all still on here to fill out the participation or attendance form. And yeah, that's it for today's event.